Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the full mouth CBCT of the patient that you had requested. The area of interest highlighted is the upper left third molar and the lower left third molar. Coronectomy is done and the patient is suffering from numbness. Now, this is on the 3D. We can see that the crowns have been removed from both the tooth. We have roots left. We have something very radio opaque, which is lodged in the ramus that we will explore. Now, this is the tooth from a axial point of view. We're going to focus on the lower wisdom tooth first. As we move down, we can clearly see that there is this very radio opaque subject or item which is visible on the axial aspect. Now, this is um, lodged into the ramus on the buccal aspect, and we can clearly see it here. We can also see that there is loss of cortical plate on the left hand side that is visible here. So this is the left side of the patient. This is the buccal side. This is the lingual aspect. We can see that there has been quite significant guttering done of the tooth on the mesial aspect. As we can see that the mesial roots have been split, and as we move further down, we see that the canals and the chambers are also involved. We have a significant radio opacity lucency, which is could be associated with guttering or could be associated with a pathology. But as we move more apically, we can see that this hypodense area does involve the inferior alveolar nerve right here. Now, as we move even more inferiorly, we can see that the roots are in close contact or in complete contact with the inferior alveolar nerve, especially on the lingual aspect. And we can see that clearly here. If we move to the sagittal view, on the sagittal view, we can see this is the tooth, the crown is removed. But as we move, this is the extremely radio opaque. This could be a metallic thing left from the previous, could be, does not seem like a burr, but could be any of the instruments. As we are moving more inferiorly, we can see that the canal is in close contact right here at the apex with the tooth. We've got this major guttering in the mesial aspect, and we can see that on the lingual aspect that the canal is quite significantly associated with the apex, and there is this radio hypodense area which could be the guttering and could have involved or could have damaged the nerve during the process. Now, if we look at the tooth from from a coronal point of view, now this is the mesial aspect. This is the, I'll show you, this is the 7, the distal part of the 7. As we move towards the 8, we can see that the lingual part and then the buccal part, the cortical plate is severely damaged. We can see that the apex, this is the inferior alveolar nerve, and it is in contact with the apical part. It is on the lingual aspect. So most of the guttering has been done on the buccal aspect, and the nerve is quite lingually to the tooth, but the tooth is definitely in contact. So any kind of movement of the tooth could have affected the inferior alveolar nerve. As we are moving more distally, we can see that there is this hypodense area. We cannot signify if this is a guttering done or if this is a radiolucency, but we can see that this hypodense area comes in contact, and the cortical plate surrounding the inferior alveolar canal disappears at this point. This is where the extremely hyper dense or extremely radio opaque white element can be seen as well. But this is where the corticalization of the inferior alveolar canal disappears, and this could be the area where any kind of damage to the inferior alveolar nerve could have been done. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.